So generally speaking, if you just ask someone about dizziness, it can mean different things to different people. And that's a little bit different. That's a little bit broader versus if you ask someone vertigo. Vertigo is a little bit more defined definition of the room spinning around you for the most part. And vertigo itself usually leads to people always probably hear of BPPV or positional vertigo. It's probably the most common type, and there are some typical signs and symptoms associated with it of maybe looking down, rolling over a bed. You just get a short duration, like, whoa, the room is spinning around me type of thing. That would be considered vertigo. So, generally speaking, that is in itself. And when we talk of cervicogenic dizziness, we use the word dizziness. And we kind of use it broadly. If you look into the literature and you go back, some cultures still use the word vertigo, especially in the Eastern cultures, and that's because they really don't have a difference in the terms like we do here. So we like to use the word dizziness because someone who is experiencing dizziness or symptoms from the cervical spine, it's very rare that it's actually room spinning vertigo. So that's a big differentiation for individuals, and because if it is something of positional vertigo, it's almost a totally different avenue you want to go down in terms of treatment. We have gold standard treatments now that are very, very effective. So the cervicogenic dizziness component is kind of a separate entity almost, even though you could have both aspects. It's just something we call a double entity. Yeah, a lot of times it could be at rest or it could be with positions. And the most common positions are most people describe are like laying in bed. So you're going and your head is being tilted back or rolling over in bed. Those are kind of your big ones, and looking down sometimes as well. So if those are your big time descriptors, but in some individuals, if the brain is really getting some abnormal signals, you might be sitting there and the whole room is spinning as well. And that happens. We do see that as well. Yeah, so we'll break it down. Typically, I'm a big descriptor type of person. I allow the individual to tell me what they're experiencing because when you talk about dizziness or you talk about something that we can't see, we have to really interpret what someone is giving us. And this is really kind of my wheelhouse and something that I feel like healthcare professionals ought to be able to do is listen versus just kind of going down XYZ because it's most common. So someone who is probably going to have more of a cervical dizziness standpoint, they will probably describe it more of a lightheadedness. Sometimes it could be even considered like I'm just unsteady. Something's just not right. Or drunkenness is a term that some individuals would utilize, and we have that in the literature of differentiations between BPV and cervical dizziness. So when someone's kind of describing, if they say, no, the room's not really spinning, it's just something not quite right, maybe more lightheadedness or something, that is one of the first descriptors that allows me to kind of keep going down this pathway.